So we're going to start session 2 now. Our next speaker is Dr. Jim Gallarda, who is the Senior Program Officer of Diagnostics at the Bill and Melinda Gates Foundation. Dr. Gallarda has an MBA from St. Mary's College of California and a PhD in molecular biology from the University of Illinois at Chicago. He has worked as a scientist at Abbott Laboratories, has taken international business and project leader roles at Roche Molecular Systems, and has worked as the Global Program Diagnostics Director at Novartis. At the Bill and Melinda Gates Foundation, Dr. Gallarda applies his knowledge of diagnostics product development and infectious diseases to improve the development and delivery of new and existing diagnostic tools for individual diagnostics, epidemiology, and surveillance programs. His talk today is titled Career Lessons from the IVD Industry to the Bill and Melinda Gates Foundation. Welcome, Dr. Jim Gallarda.
Okay, well, good morning, everyone. Alex, thanks for the introduction, and Kevin for the invitation. So, anyway, today, when an old friend, Pete Daly, told me about the program here today, and when I got the invitation, I was thinking, well, what shall I talk about? So, I was thinking stuff like very detailed technical stuff for product development, and then the old man in me started thinking, nah, I'm going to talk a little bit more about careers. And the reason is that I've given these talks before, and it's really interesting. If there are graduate students in the audience, they're trying to figure out, well, what's the road ahead look like? And postdocs, especially those who are married, have wives who are saying, you got to get a job, buddy. And so that's kind of what happened to me. So I'm going to give you a little kind of historical narrative about my career path and touch on some of the lessons I've learned both on the technology front and the disciplines in product development, as well as some lessons learned on the human front and in the path that I've had. So so today I'm going to go over kind of my chronology and my career, talk about my lessons in education, where I worked at, what are some of the big lessons I've learned, and really, comparing big companies to small startups to now this very interesting world of NGOs and the Gates Foundation and global health. So I got my PhD like eons ago in 1985 at U of I, and then I went on to a postdoc at Northwestern, and I'll touch on each one of these, but a couple of them are going to be rather interesting to relate, and one of them was in 2002. Pete Daly and I we were talking about this morning. There was this emergency meeting called by the FDA and the CDC regarding West Nile in the United States and the threat to the blood supply. So we have some stories, probably after a beer or two, Pete. It might get more entertaining. But I want to reflect on some of these lessons I've learned, and really it's kind of give you guys a heads up what the path forward might look like. So I started out not at all in molecular biology or diagnostics, but I was a wildlife biology major. And I thought my career was going to go look at avian tuberculosis in the Pacific flyways of the mallards in California. And, I got a bachelor's degree, and then I worked on a master's, which I never finished because I got started on a PhD program. And but in that MS program, I had one instructor who really turned me around to go away from kind of wildlife biology to molecular biology. And you guys may also, in your path, have one or two people you can think of who really change your trajectory. So those mentors, I'll be talking about mentorship here in a little bit, but this was a really practical first experience for me, and it really impacted my career. I went on to U of I because of Dennis Huff to get a PhD in microimmunology, and there I was fortunate enough to have a very strong advisor, Catherine Knight, there, who really took to heart developing her students. And so mentors are really quite important in our lives, but they're not easy to come by. And they have to be close to you. They have to see you in action in order to be effective mentors. Went on, did a postdoc at Northwestern, and you'll see in a minute, actually started a job. And very late did I go back and do something that I profoundly wish I had done much earlier, and that is got an MBA, because it changed my worldview. I was a science technology guy. I viewed everything in terms of analytes and sensitivity and specificity, and this opened up my eyes to a much broader dimension that was really quite influential. And then kind of the educational component is there's some stuff you just don't learn in graduate school, and it's on the job. And I'm going to tell you a few of those lessons I've learned in that respect. So, so my wife did kind of heckle me to get a job, buddy, kind of thing. So I joined Abbott Laboratories in Chicago and worked on HIV immunodiagnostics first. So that fourth generation PRISM assay, the antigen antibody stuff. So that was my baby when I was there. So that was really my first real job after a postdoc. And I can remember the first day there was an employee orientation, and this is what companies do. Big companies have employee orientations, and we were in about 20 of us in a room like this, and this funny-looking little guy named Robert McDonald was out of HR, and he was saying, "Okay, we're here for employee orientation, and I've got a question for you." So we're all, we've got our notes on our desk, and we're taking notes. And so he said, "What's the meaning of life?" And I thought, oh no, what have I gotten into? This is not what I came here for, right? So anyway, it turned out this was a very important question, because the guy said the meaning of life is growth. And that's really, now I'm the old man looking back at that, I'm thinking, yeah, he's right. Not only on a physical dimension, but in a mental dimension, it's the same thing. Is that the day you stop growing, you just check it in, right? So that was my first lesson at Abbott Labs, and that one has stuck with me my entire life. And so, as I went through Abbott, I started to ask the question, well, is there a mentoring program here? And I'll come back to that in a minute, because you might be surprised about the answer. Other key things that, I grew up in an academic world, getting a degree and going on a postdoc, and you're mainly trained as an individual contributor. But in industry, there are roles for individual contributors, but when you get into product development, you're not really an individual contributor. You're working as a member of a team. So I had virtually no training in my graduate education for how to work in a team. So there was a lot of learnings there, that were sometimes painfully acquired, but nonetheless were quite important. So this was one thing. And then the other was, as you start out as a bench scientist and you work your way up to, eventually at Abbott, I was a section lead and managing a lot of people. And also in graduate school, you're not really taught how to manage people. You either have that skill, or you acquire that skill, or you don't, and you hope that you get slotted in the right place. But the competencies to manage people and the issues, they're completely different than those to be an individual contributor. So the most lasting lessons that I got were out of Abbott, and I was there about 9 years, where they weren't so technical. And the first one was, don't get too comfortable. Stay on the edge. Because in the edge is where you're going to learn, and on the edge is where you're going to grow. So for sure, develop your competencies, but don't get satisfied. And so this was one lesson. The second is, very seriously, is you better know yourself. Old ancient advice, right? But there's a lot of wisdom in that, because as a young guy working, in a job, I thought, no, I know my stuff, and there's a lot. I frankly didn't have an honest conversation with myself. What am I really good at? Book it. And what things am I not so good at? Okay? And if they're important for my professional advancement, better take account of it. Having that frank conversation with yourself is really important, because that allows you to recognize the gaps and to take action to fill them. Secondly, this know your audience kind of goes with this next one, Myers-Briggs and communication. How many of you are familiar with Myers-Briggs? Just raise your hand. Great. Okay, so Myers-Briggs, you kind of get a snapshot of yourself, and you learn about how other people are wired. And you may have a very important message for somebody, but if you don't know how to communicate it to them, you have no message. So knowing your audience and being able to communicate at a level with where they're at is really quite important. And at Abbott, it actually was important from a thing that Abbott senior management had, which was called their grilling sessions or their barbecue Wednesdays. And this isn't where they're serving hot dogs. This is where some program officer has got to go in front of the VPs and the president of the division to explain what is going on. And these guys are pretty smart. And they're very perceptive, and you can dazzle them with data, but they're going to drill down to the most essential questions. And there you had better know your audience, and you had better have an answer appropriate for them. So these were not technical lessons I learned at Abbott. These were kind of human lessons. But there was an important aspect of product development that I did learn that was on the technical side. So I'll go through a couple of these, the discipline of design controls and best practices in assay development. But what I want to show here is that in this pyramid of competencies, it's almost like a foundation for us is to have a set of tools in our toolbox that are technical competencies. These are the basis for our professional advancement. Necessary, but alone not sufficient. You've got to have the human competencies as well. Communication, knowing who you're talking to, be willing to have frank dialogue, because if you're going to be successful in these very expensive programs, you can't have a bunch of people saying yes all the time. And then a third dimension, which I won't get into, but perhaps over a beer is worthwhile discussing, that is political competencies. And that is, you may have really good human skills and technical skills, but there's another dimension that is important in our professional lives, and that's in the area of political savviness. So this pyramid, I've looked at for most of my career, and people who know me would say I'm still not at that top part yet. I'm still kind of in the middle to bottom part. But to the degree that you can be aware of this early on in your career, I think you'll do well. Design controls. How many here are familiar with this term? Okay, so this is something I think as an IVD development guy, you should commit to memory. CFR 820 Part 30 is entitled Design Controls, and really this is FDA's terminology for a disciplined approach to product development. And it covers 9 or 10 dimensions, and I won't get into them, but some people's eyes gloss over when they see this stuff, but if you've ever had to be accountable for a multi-million-dollar project with a lot of people that whose reputations are on the line to deliver, there must be a disciplined way to do this. And so this aspect of the quality system regulations is foundational to product development. Now, one of those elements is a design and development plan, and so this is a waterfall diagram from the Canadians actually came up with this design, and basically talks about you start off with user needs, and Sam, you talked about the user environment, and really you have to understand that environment. You just can't say, look at what I've got. This is the greatest thing since sliced bread. And you go put it into Rwanda and you find out, oh, wow. Good story at the foundation is we had this program for mosquito nets. And mosquito nets, the first ones that came out, what a great idea to control malaria. Just bed nets, put overnight, prevent mosquitoes from biting people, right? Great idea. Cheap, effective. So they made millions of these nets, and there was little uptake. The countries where we wanted to put them, they just weren't getting in for some reason, and nobody really understood why. Well, it turned out that, in the mass manufacturing of the mosquito nets, they were all white. White in these countries is not a good color. White is a symbol of death, or a message related to death. So there was a social aversion to these mosquito nests because they were white. Well, the guys in the West who thought about this whole thing never went out there to find out in the user environment, is this going to fly or not? So all of a sudden, you'll see pictures at the foundation of the mosquito nets and being manufactured. They're all blue. So understand your user environment. This is critical. Now, there are a whole bunch of documents that go along with this, and the FDA has a saying, if you didn't document it, it didn't happen. So you can have the best thing, from a platform, but there is a series of documentation within a quality system that you've got to nail. And you're just not, you have to go, there's no way of getting around it. So anyway, this process, this formal process of design and development, where you identify your user needs, that creates a bunch of inputs, you do the development work, and you then ask, okay, did we get out of that what we thought we should get? This is verification. You do this over multiple iterations, culminating in a clinical validation. Then this is the IVD design development process. And a lot of people think that once you get into this, it is mind-boggling bureaucratic. It's just like, especially guys who like to do research do not want to have to fill out all of these documents, right, required for FDA. So you can get pretty buried in this kind of stuff. And some people may think, well, then a miracle occurs. But believe me, there's a reason for this to happen. And I think the best companies balance the bureaucracy with the innovation. Well, within assay development, there are a couple things I've come across that I would consider best practices. And if you think about populations, and you've got some analyte, let's say an HIV population, and a truly negative population, it's really about hitting a target and separating the negatives from the positives and doing it accurately and with precision. So, I've given this talk before, and I came across this this painting. This is a painting of the use of a catapult in the Punic Wars. This is Rome against Carthage. So this is like in 146 BC, and in this painting, inscripted on the side, is from Cato the Elder. Delenda es Carthago, or Carthage must be destroyed. Okay, so you see a bunch of guys there working on delivering a payload, and this is kind of, there's some lessons in management here related, because a guy named Dionysius, who was one of the early developers of the catapult, he would walk around the troops, he would bring people in, experts from all over the world, and talk about, okay, how are we going to pull this off? How do you deliver a payload? Because we're going to do this for the purposes of conquering, other cities. So, he would gather skilled craftsmen, collected everywhere into one place. They had high wages. They offered numerous prizes. He managed by walking around when interacting with the troops. So this is actually what happens with good managers. They are engaged with the guys who are actually doing the work. And so you don't learn this in graduate school, or I didn't learn it in graduate school, but there's some lessons here that I think would be valuable, because many of you'll start out as researchers, and you may end up managing people. So these lessons in people management, I think, are essential. And then for the engineers, whether you're hardware or software or reagent engineers, then this guy, Philo of Byzantium, he came a lot later, but he said they looked at the ancients, and the ancients were the guys in 399 BC, right? So he's in 200 BC, so it's all relative. But he observed that they really didn't tackle this from a systematic approach. So they actually applied experimental approaches to guide the improvements of the catapult. And at the end of the day, these catapult engineers combined both mathematics and engineering to arguably develop a weapon system that changed the face of the Earth back in those days. And the lessons today are we're today's engineers. So the catapult remains with us. Now, there's this thing called a Statapult. Has anyone heard of this? So if you go on the web, type in Statapult. It's really quite interesting. This is a little toy that's composed of a dozen or so pieces. And people who teach statistical process control and design of experiments will use the Statapult, and they'll give it to a group of people and say, okay, well, I want you to assemble this thing and take the little ball that goes into the cup of the catapult and hit this target 30 feet away. And when I did this, it was a target of Coke cans that were about maybe 2 feet high, so a little pyramid of Coke cans. We put that thing together, and this ball went everywhere. Okay, it was just all over the place. So round one, we were kind of thinking, well, let's do this by empirical observations. And so we were not accurate, nor were we precise. We weren't hitting the target even. So then we went through multiple rounds, and finally, after many rounds, we got to a point where we could hit the can. Well, so there's a set of tools in product development, and design for Six Sigma is a discipline that contains many of these tools. DFSS, as it's called, is a discipline where if you look at the stage of product development and the cost of developing these things, is that the cost goes up. And where you can use DFSS is early in the R&D stages to more efficiently, with less expense, develop high-quality products. So, so this design for Six Sigma, which comprised of multiple tools, and I mentioned a couple of them, DOE, design of experiments, and statistical process control, really focuses on, okay, know what your customer needs. Okay, and if you're developing processes for manufacture, reduce the complexity, because the more steps you have, the more place you get errors, and then an error budget starts to accumulate, and that's why you have imprecision. And then if you look at reducing the complexity, if you're looking at the process itself, is you can improve your accuracy and precision by methodologies to separate these two populations, the negatives from the positive. So this is really, as I worked at a large company, Abbott Labs, these were some best practices that I observed that were instrumental in efficiently developing diagnostics that would also reduce cost and work better. So the point is, if you can rely on these kinds of tools, is you can do this instead of 10 rounds, you can hit your target in much quicker fashion. Okay. Well, coming back to kind of my own professional chronology, I decided after working at Abbott, you know, God, I'm just kind of I want to do something different. And that's been my story. Like roughly every 5 years or so, I've just made a change. And so I decided to join a startup. And this was Mosaic Technologies in Boston. So I was employee number 10. They had secured a US patent on solid phase PCR, which I thought was really cool. These were very researchy guys, but the company lasted less than 5 years. And this is often, sadly, the case with startups, is that they're started by really innovative, creative people, often researchers, who have an idea for a product, but then they don't make it for some reason. In the case of Mosaic, was that lack of focus was a problem. The founder of the company was interested in life science products, and the guy he brought in as president was interested in vitro diagnostics, regulated diagnostics, and they couldn't see eye to eye. So now the thing I learned, you know, I can remember going out there to interview, and you know, what you don't discover in the interview is a good 50 to 75% of the story. And you discover that 50 to 75% after you arrive in the next 6 to 12 months. And so I got there and I said, oh my gosh, this is not Abbott Laboratories. You know, there's a lot of confusion here. And on the one hand, it was exciting because there was a lot of innovation. On the other hand, it wasn't a lot of discipline. So, you know, so really I got there, I went there thinking that, okay, this might not fly, but it would be a stepping stone to something next, whatever that might be. So some of the lessons, you know, I learned were, okay, things change. And actually, this is okay. You know, some of us have careers in one place for 30 years. Okay, works for some people. Some of us are going to move around. And it'll either be because we decide to move around or because conditions dictate that we must move around. But move around they will. And so, one lesson is be prepared for change. The other is, again, get near the edge. Don't get too comfortable. Don't get complacent because you think you know a lot. But keep trying to grow, because your value to your organization and your marketability will be influenced by your tool set. That tool set happens because of your varying experiences that you have over your career. So the other thing is that in small companies, innovation often happens in small companies, but because they don't have, they're missing something, they will often fail. Once a large company like an Abbott or a Roche decide to do something, usually it happens, not always, but usually, because they have a multifunctional team, cross-functional team of people whose competencies help ensure the project is successful. So execution usually happens in larger companies. Well, I went on after Mosaic and joined Roche Molecular Systems, and I primarily had a managing position there in their blood screening program. And this is where Pete and I worked together. And when I was at Abbott, I was wondering about the mentoring program, and the question was there a mentoring program at Abbott? The answer was no, even though HR formally had what they called a mentoring program. Same thing at Roche. And here's the take home, is that you own your own mentoring. Don't expect people to come up to you and say, "Can I be your mentor?" It's not going to happen. If you want to make it happen, you have to make it happen. So my best advice is to wherever you are, with people who are ahead of you 5 or 10 years, and you see something that looks like a best practice, go to them and talk to them, and just begin to establish a relationship and get somebody who can give you frank advice about what things are in your toolkit and what are some gaps. And again, once those gaps are identified, you own them, right? No one's okay. You get the chance to fill them or not. So that's in my experience, that's where mentoring happens. Is you take the initiative. A lot of people out there who can help you. But surprisingly, I just don't find a lot of people doing this. When I was at Roche, my first day, I had a department meeting with is about a group of 50 people. I said, we have 2 objectives. The first one is we've got to get this project done. There's a day it starts, and there will be a day when it's over. And we were developing PCR assays to screen blood for HIV, HCV, and hepatitis B. Later, West Nile. And so there's going to be times when it's going to be frantic around here, and then there's going to be times when it cools off a bit. But we are here to execute this program. This is the first reason we're here. There is a second reason, and that is to fill your toolbox. So some of the new people right out of school are like I would call apprentice mechanics, and they have toolboxes for sure, with tools in it that they know how to use. And then there are guys who have been doing this for 30 years, and they're like master mechanics, and they've got a whole garage of tools, and they know how to use those tools really well. So the second aspect of a manager in a company is to develop people. And the reason is that a day will come when either the company appreciates you for your tools you have or not. If they don't, its competitors will. So take care of this toolbox and try to get yourself positioned so that you can grow in those tool sets. So the second thing that really, when I was at Roche, I went back and got an executive MBA, and this was the thing I wish I had done a lot earlier, because it just changed my view. I had no real working knowledge of sales and marketing or business contract or IP, communication. Statistical, process statistics, Q theory. These were things that I just had no worldview, and so the MBA really opened up that world to me, and consequently, I did another change. So I was working exclusively in infectious diseases at that point, but then with that, I go, okay, there's got to be something more, and so I ended up moving into genomics and oncology, and so Michelle, this is where I think we met. And there I was the international business leader for genomics and oncology, which for a technical guy, you know, it's kind of weird, right? You know, you just don't normally hang out with the marketing types. But that was a really good on-the-job experience for me, complementing the MBA. And I got to see a lot more, like if you have to do you've got a product and you want to build a forecast of that product because you're trying to convince your investors that, you know, this is something worth investing in. Well, knowing how to build those forecasts in a credible manner is something that, you know, you can't learn. You know, you get a basis in an MBA program, but then if you're in charge of that business, you get real world on-the-job training. So this was this changed my entire view of things. And and during that time, there were 2 books that came across, and so I'd recommend these 2. These are my top 2 business books. The first one is by Michael Watkins, The First 90 Days. And this is about you move from one job to another. And the clock is ticking for you to show your value. And you've got about, according to Michael Watkins, about 90 days. And after that, people are going to judge you for what they've seen. And every one of us, when we come into a new role, we are a drag to the organization. Because I'm meeting with somebody who doesn't have time to meet with me. And I'm taking their time away. But eventually I come up the learning curve, and once I reach kind of net zero, that's 90 days. And from that point, you hope that you are a real contributor, right? You're adding value to the organization. So Pete Daly gave me this book. I don't know if you remember this or not, but I've read it several times, every time I've made a move, and I always get something out of it. So it's a superb book. The other one is entitled Who Moved My Cheese? And it's all about change. And it's kind of an Aesop's fable of a couple of mice who come into their maze and they find out the cheese is gone. And I have a couple of colleagues who are kind of complainers and say, I don't like this. And they're just sitting around complaining while the other 2 mice go and figure out, well, what do we do now? So it's a great book on change. And if with my generation, you know, if I've moved, you know, every 5 years, it's quite likely some of you may be rather mobile as well. So this is another great book to have in your library. Well, so after Roche, I got a call from, I've been working in genomics and oncology, and Novartis Pharma had decided to establish a diagnostics unit, which was kind of weird because you talk to pharma companies and, you know, at best, they're not familiar with diagnostics at all. And more often the case, they consider diagnostics as kind of annoying. There's a little brother who, oh yeah, okay, you do your diagnostics thing. But interesting, there's a thing going on now where, especially in oncology, companion diagnostics are going to determine whether the drug is going to be used or not. So I moved into Novartis in Cambridge, and really what Novartis and other pharma companies have come to see is that, you know, the drug pipeline is not all that great. And the day of the blockbuster drugs, those are going to be increasingly rare. So most pharma companies now have some kind of a companion diagnostics effort, whether it's by a relationship with an existing diagnostic company or they bring in a competency in-house. But yeah, so really the issue is, can we use diagnostics to inform a prescription of a drug? Let's say you've got a drug and it has a particular mechanism of action or a target, and that target is the target for the diagnostic. A good example is in chronic myeloid leukemia. This oncogene BCR-ABL is the target for a tyrosine kinase inhibitor that Novartis sells called Gleevec. Okay, that biomarker is the diagnosis for the disease. It's the root cause of CML. And its level over treatment is the diagnostic monitoring of the effectiveness of the drug. So there's a recognition by many pharma companies now that this could be a paradigm for future drug discovery, and that we can do smaller clinical trials faster and cheaper if we can identify the responding population. So this was my venture into Novartis, and you know, in oncology, it really is a fascinating area. I mean, you know, there are dire needs within oncology. The biology is exquisitely complex. The technologies for querying, you know, the network of molecular events to ask, well, what's going on with the disease is really unbelievable. And then the business value of diagnostics is increasing. So I moved in this area, and it still remains of great interest to me. But then, you know, in the fall of 2012, I think it was, I got this call out of the blue from the Gates Foundation. So, so I was really quite happy working on what I was working on. It was really interesting stuff. And so when they called and said, you know, we're looking for people with product development experience to help us kind of guide our strategic and tactical investments. So I thought, yeah, I'll just go out there and at least network with folks and just, you know, maybe later on down the road, you know, something can happen. And all I can say is I went to Seattle for the interview, and this wow factor, it really was. I was like, God, I can't believe this place. It's like, you know, and so one thing led to another, and you know, my wife and I, we moved out to Seattle, and you know, it's interesting. You know, the return on investment premise within industry is kind of the bottom line. You know, is what is your profitability for an investment? And at the foundation, Sam had a couple slides talking about another metric of ROI, and this is DALYs, or disability adjusted life years. So what is really the currency of ROI at the foundation is this DALY. Is if we decide to invest, to give a company a grant to do something, we're going to be crunching some numbers and to understand what is the real economic impact of this intervention. And to the degree we can bring that down to levels that are commensurate with the economies of these markets, then it's to that degree we're interested in funding the grant. So this is one dimension of the return on investment. So that was really quite a striking difference from my experience within the industry. The other thing is that I was an IVD guy, and I knew quite a bit about product development, and all of a sudden, you know, I heard this term global health, and I go, yeah, I know what global health is. And then I met Madhu Pai, and Madhu took me around India and to see what the story was like in a TB, and I was going, man, I got a lot to learn. I just had no idea the complexity of what global health really meant. And I'm still on the learning curve in that regard. So anyway, this was now, once again, moving into another edge, another frontier for me. And that's where I want to be, because that's where there's a lot of change, and that's where there's a lot of learning. And there's a lot of growth at the same time. So I've only been at the foundation now for 8 months, and you know, the key lessons again. I come back. Change happens, right? And so get out of your comfort zone. Be willing to step out of that, and that's where you'll grow. And the other thing is something I've been reflecting on lately, and this is you know. A professional path needs to be guided by something more than ROI. And really, this is kind of a moral compass argument. And that is, what are we really doing here? I mean, on the one hand, if you're early in your career, there's this excitement and growth and many really positive attributes. But as I reflect back on some of the stuff that I've done, you know, I think the moral compass needs to be more prominent in our thinking. I'll give you a good example. When I was at Abbott, I was working on HIV assays, and we were working on the third generation test, which would detect both IgM and IgG antibodies, and we would go through tens of thousands of blood samples in developing an HIV assay. And I got to the point where, you know, I could speak to a large degree on all the things that assay developers like to talk about on performance of an assay, okay? And I'd give talks about this. And then a friend of mine was admitted into the Howard Brown Clinic in Chicago with pancreatitis. And he had HIV. And so I went to visit him. And there I saw for the first time the despair on the faces of the friends and families of the patients admitted to the Howard Brown Clinic. And that's when I woke up. That was the beginning of an awakening. That there's a lot more to what we're doing than simply test tubes with barcodes and talking about analytical precision. There's another dimension here, which the older I get, the more I think I wish I'd taken better care to be attuned to, because this adds a dimension to our life that we should not ignore. And it's an engine that drives innovation and endurance. And I was talking to Madhu and Pete this morning about, you know, sometimes you find in graduate school as well, where you just are dead beat. Just tired. Like, too much, it's too much. And then all of a sudden you may have a conversation or something happen where your attention is fully engaged. And all of a sudden your energy is back. Well, I think in this area of global health, and this is why I am thoroughly enjoying the foundation, and that is this is something that we face daily. And that is, what is the human face behind everything that we're doing? So this is a lesson that I'm kind of being reminded of as I come back into infectious diseases. And Melinda had this saying, and if you come up to Seattle, we have these signs all over next to the facility in a visitor center. Whatever the conditions of people's lives, wherever they live, however they live, they share the same hopes and the same dreams, just like you and I. And this is really where Bill and Melinda, they really come from, this perspective. And this is what drives the foundation. So if I had to wrap up, you know, things kind of start with a formal education, but it continues with on-the-job training. Secondly, have a frank conversation with yourself. What are you good at, and what are areas to grow? And then it's up to you to fill those gaps. Don't get too comfortable, stay on the edge, because that's where exciting things happen. Mentors are not going to come to you. If you want to accelerate your growth, seek them out and have them help you in your professional path. Change is going to happen, so be prepared for change. Max out your toolbox. If your current employer doesn't appreciate your skills, its competitors will. And then lastly, I think the meaning of a career is ROI is not measured only by the bottom line. So with that, I will stop here. Thanks. Questions? Yeah.
You say that you're not focusing on return on investment, then how do you quantify your effectiveness of your investments?
Yeah, that's a good question. So we have these, so we do quantify, the ROI is, well, I mentioned DALYs, or disability adjusted life years. So if we do a grant, then there will be an analytical assessment of the DALYs that are achieved with an intervention. Then getting it kind of more practical, we have these things called co-chair meetings. And they happen usually the first quarter of every year, sometimes more often. And there you're in a small room with Bill and Melinda explaining your program. And you give them pre-reads a week before. And Bill especially apparently has a photographic memory. And so he will be quite familiar with the pre-read material. And the first co-chair meeting I went to when I first joined the foundation was last March. And there was a person presenting, and Bill was sitting there quiet. And just, you know, you're not sure whether he's tuned in or not, but all of a sudden he fires the first zinger question. And these are all about, you know, challenging our assertions, why we think a particular program is worth investing or not. So these are my two answers to your question. DALYs are a practical currency of measurement, and then a conversation with the co-chairs on defending the investment. Yeah.
Thanks. Yeah, I was wondering what you see as the role of industry and nonprofits such as the Bill and Melinda Gates Foundation for advancing diagnostics in the developing world, and what you see as the advantages and limitations of each type of organization for advancing in that field.
Yeah, so, we actually don't do R&D ourselves, right? We have to rely on people that are doing the work. And so we have grantees that range from academic players who have some innovative technology that they're looking at to full-fledged IVD companies that are developing products for the markets that we want to serve. So, and then interestingly, we have a point of care initiative where we brought together diverse players, ranging from the academics to full-fledged IVD companies, to ask whether or not we can create something that would not normally be created by separate players because they simply don't hang together. So we're bringing them together in a point of care initiative to see if we can come up with something that is a benchtop device that can address multiple infectious diseases, do it in an inexpensive yet high quality and robust fashion. And what's absolutely remarkable about this is not my project, I'm just kind of an observer, but what's remarkable about this project is this combination of innovative kind of researchy guys who are coming up with novel ways for sample prep. And now you've got somebody else over here who's got this really cool isothermal amp detect system, and they normally would not be talking to each other. And then you've got large companies that have full-fledged IVD programs, and not only do they have R&D departments, but they have every element of the value chain all the way through to sales and service, customer support on the phone globally. Okay? These guys often don't get together. And so this is one role the foundation plays, is to try to facilitate that cross-communication. And let's see what comes out of it. Does that answer your question?
Yes, thank you.
Yeah. Yeah.
If you see the dynamics of diagnostics and the therapeutics, there seems to be a serious imbalance. And you played actually on both sides. I was wondering your thoughts on less than 5% investment in diagnostic that controls over 2/3 of the costs. Yeah. So what does the foundation, is anything being done to address that imbalance?
Yeah, this is really remarkable. I've seen this. My observations come from working in diagnostics at Roche, but it was working for a diagnostic company a sub-company within a large organization that also has a big pharma unit. And in the area of companion diagnostics, the diagnostic guys they were viewed in a different light by the pharma guys. I'll put it that way. And the same thing at Novartis, where you're embedded within you're accountable within the pharma organization. It's not a separate diagnostic company. It's your pharma, but you're doing the diagnostic work or facilitating it. And I think there is a slow recognition by pharma of the value of diagnostics. However, the conflict is that most pharma companies would just love to see if there's a biomarker that's a target for a particular drug. Now you need a diagnostic to detect it. Get a dozen companies, all who will detect that, and to drive the price down because they don't want to take a margin hit on the drug. And so there's still this disparity, I think, between the view of the value of the drug versus the value of the diagnostic. I think at the end of the day, you can have the best drug, but it's kind of like that catapult. If you're firing the payload and it's not going to the target, you're spending a lot of money for ineffective medicine. So I think there's a slow emergence, although not to the satisfaction of many diagnostic guys, about the value of diagnostics. But I think it is improving, but we have a long ways to go.
I take the liberty to ask you a second question, which is, everyone in this room, every startup and everybody would look to have an ability to get funded by Gates Foundation. What are you looking for when you come up with the idea, and what's your advice to people in this room for getting funded by Gates Foundation?
Yeah, so I mean, what's clear is, this is a family foundation, which means it's not a corporation with a board of directors. Bill and Melinda, they are the foundation. And so we have areas of focus within global health, and they are focused on diseases of poverty to a large degree in emerging markets. And so I work in TB. HIV is big, malaria, polio, some neglected tropical diseases. These are the areas of focus. And within each program team, disease-specific team, those teams are the decision-making managing units for everything that happens in that disease. So with TB, we have guys working on drugs. They range from medicinal chemists all the way to CMC guys. And we have vaccine people, likewise, from early research in vaccinology and immunology all the way to manufacturing. And now diagnostics. So to give you an example, for TB, we have a strategy. And the strategy is to reduce the incidence more rapidly of TB in these neglected countries. Secondly, now there is the emergence of drug-resistant TB. That is not going down, it's going up. And when you think about TB, moving, and Madhu, you'll probably talk about this later on, but if you think moving from disease that is curable, but the sad fact is today about 1/3 of the world's population is infected with TB. Okay, and now you're getting misuse of drugs and the emergence of extreme drug resistance, then the specter that this could become an incurable disease. Okay, so a second element of our strategy is to try to counter this spread of drug-resistant TB. Every investment that we make starts with that. So if someone calls me up on the phone and says, hey, I've got this great device that will test for latent TB, sorry, out of scope. So to answer your question, if you are a startup or you have something that you're working on and you think it might be of interest to the foundation, try to do some homework. Go on the website and see what the charter is for the specific disease area. Because the conversation will be either real short or it could be more extended. Yep. Yeah.
Do you see a disconnect between solving a global health problem by developing novel technology versus solving that problem by focusing on process development around technologies that already exist, finding ways to make things that exist work better as opposed to solving it with a new technology?
Yeah, that's a good question. I would answer it from a historical perspective. If you look at any technology in the last 100 years, often it starts out as a very kludgy, let's take clinical chemistry, some guy with a borosilicate test tubes and corks and pouring chemicals to get a color change. Okay, yeah, so he can detect, some analyte. The guys who were in the camp, let's stick with the borosilicate tubes and corks, probably are going to be extinct, because people like you are always figuring out a better way to do things. So I think to some degree, the existing infrastructure and improving that is going to be important and is going to work and is going to contribute to improving global health. There will be people who build upon that, and there will be incremental improvements, and then there's going to be some of you guys are going to leapfrog to something new. And if it's really got value, it will make the earlier technology platforms obsolete. So I think it's a balance, and I think there's a grand experiment that's going on where you have both of these playing in the market. The proof will be in the pudding. Who's got what really is going to add value versus not. So that's kind of a circuitous answer to your question.
Sort of follow up, though. Where I see the disconnect is that there are a lot of funding mechanisms for developing novel technologies. There isn't much of a funding mechanism for taking something that already exists but is too kludgy to really work in the real world and making that better, making that applicable in developing countries. I think there's a disconnect in the availability of funding because there's no commercial ROI for that. And then on the academic side, there's no novelty in it, which gets your ROI in terms of publications and grants.
Yeah, it's a good point. I would say, if you've got a value proposition for an enhanced existing technology that is going to really improve an outcome, then you've got to get in front of the right audience. And so, I mean, the foundation, if it's in line with our disease area strategies, and you have a credible argument, and this is why know your audience, because if you come to the foundation and you say, I've got something that's going to really, you better have your act together, right, and have a credible argument, because it will get queried by a lot of people. And if it passes the sniff test, then it'll be a lengthier conversation. Yep.
For a project that the foundation is interested in funding, what's the interplay between the grant and potential venture capitalists that are involved in that project? Are they mutually exclusive, or do you work with the other venture capitalists to form an agreement, perhaps?
Yeah, I think at the end of the day, we have a dimension of our grant process that addresses sustainability, and that is even the Gates Foundation doesn't have enough funding to pull off what we'd like to do. We just do not. We are literally a drop in the bucket when you think about it. So there is a real need to, in co-funding fashion, to find other ventures, whether it's venture capital or angel investors or institutional investors, to chip in on some of these programs. So I think we're agnostic as to what other funding parties might be interested in doing this together. In general, we would rather not do it alone. We'd rather do it with others, because the day will come when we're going to back out. And you hope either it becomes self-sustaining from a sales perspective, or other funding mechanisms will take it the next step.
I imagine it's case specific, when it comes to the project. But do you find yourself one of the players, or sort of one of the players that potentially corrals other investments into that sort of project?
Yeah, I have to say I haven't been there long enough to know for sure. However, I will say that sometimes we will have grantees, and it'll just be a flat out grant. In other cases, we may have what's called a program related investment, which is a loan or an equity position in the company together with other funders in that same company. So it can take on multiple forms.
Thank you.
Okay, any other questions? All right, good, thank you very much.